You know, Dr. Barbara Ferrer is not a medical doctor. She is the LA County Department of Public Health Director. She gets paid in excess of $500,000 a year, and yet her PhD is in social welfare from Brandeis University. And since some of us have begun to make a stink in the media about this, they have now come out and said, well, she never said she was a medical doctor. May or may not be true, but there are various websites that say she is in relation to her. Let me read a little of that idea. There are a disturbing number of references to her as an MD on official websites for professional organizations and health foundations and in annual reports. August 15, 2019 press release, the Network for Public Health Law announced Dr. Ferrer, MD, PhD, as a new member of their National Advisory Board. Blue Cross Blue Shield Massachusetts Foundation listed her as a board member as an MD, leaving off other credentials. And their 2007 Community Benefits Annual Report, as submitted to the Office of the Massachusetts Attorney General in May of 2008, at the time, Ferrer was the executive director of the Boston Public Health Commission. Other websites. Breastfeed LA Equity Summit. She was listed as a medical doctor. October 10, 2018. So was she touting that she's an MD? I'm not saying I've seen any of that. Maybe she has, maybe she hasn't. But it's clear that they haven't quantified the misconception. Even reports to the state attorney general. MD, right? She was interviewed a couple weekends ago on local KCAL and asked about the criticism of her qualifications and credentials. She went into this long dissertation and said somehow, well, it's not just me that makes these decisions. I surround myself with other physicians, and on and on and on. And then you hear people like former Santa Monica politician, now Sheila Kuehl, she's a supervisor now. She's kind of moved her way around the political, local government. She interviewed Ferrer, and one of the things she said, the quote, "I'm very grateful to have our Director of Public Health with me. Dr. Ferrer has been compared by many to Dr. Fauci, who is known most for truth-telling, telling truth to power." Where have you heard that expression before? Kuehl said, my point of view anyway, is we've got to go through and go with the science. I'm trusting Dr. Ferrer to lead us through this because it's the experts who really understand, end quote. Truth to power, really? By the way, under a new state law that was passed last year, signed by Governor Gavin Newsom, local health officers have a very broad and unchecked authority. AB 262 provides them the authority, quote, during an outbreak of a communicable disease, end quote. AB 262 provides that in such a situation, even in a situation in which the health officer deems there is a, quote, imminent and proximate threat of a communicable disease outbreak or epidemic that threatens the public's health, end quote. In other words, she has a lot of power as mandated by our governor. So all of that to be said, she is not a medical doctor. She has a PhD in social welfare.